Welcome to This is Public Health, brought to you by the Tuscarawas County Health Department. My name is Jennifer Demuth, and today we're going to be talking about infections, specifically how to maybe not get infections, because in this world, we all have very busy schedules, and no one has time to be sick. So stay tuned. We're going to learn from our experts from the Tuscarawas County Health Department today about how to prevent infections and keep from spreading them to those around us. So the key is to spread joy and not germs. All right, I'm very thankful to have with me today Valerie Wallace. She is an RN and one of our communicable disease expert nurses at the Tuscarawas County Health Department. Welcome, Valerie.
Thank you.
Good to have you. All right. Also very fortunate to have with me Chelsea Martin. She is an RN and one of our nursing supervisors at the Tuscarawas County Health Department. And she's also an expert in communicable disease. So I've got the best experts here to help our county residents today. Sounds good, right?
Yes, thank you.
All right. Good. Good to have you. So, we really do when we're out and we're gathering with others, because here in Tuscarawas County, we love to get together. We like to get together with the people we work with. We like to get together with our friends, maybe our church friends or friends that we're in a club in. Also, we love to get together at sporting events and family reunions. And when we get together, it's wonderful, but we don't want to make folks sick, especially if there are younger members of the family, babies who are more susceptible to severe illness, or older members of the family who might be, more susceptible to getting a very bad sickness. So how can we spread joy and not germs? And that's really what we want to talk about today. So Chelsea, let's start by getting a general understanding of the steps we can take to avoid spreading germs and infection. What are some just basic steps we can take?
So just to list off some basic steps for preventing infection, of course, we want to do regular hand washing with soap and water for at least 20 seconds. Practice good food handling if we're having gatherings, making sure temperatures of foods are kept appropriate, covering coughs and sneezes, that cough etiquette. And of course, if you're not feeling well, having any sort of symptoms at all, making sure to stay home so to not spread those germs.
Yeah, and the staying home is such a key element, and if someone really can't stay home, because sometimes we have a person who says, well, my supervisor is making me go to work or I'll lose my job. That does happen, and sometimes that can't be avoided. So if you're not feeling well and you have to go out, what are some measures you might be able to take to help avoid spreading those germs?
So if you do have to go out, of course, we've heard a lot about COVID the last 2 years, and if you're able to take a COVID test prior to going out, we would recommend that. But regardless, if you do have to go out, again, making sure good hand washing, covering cough, sneezes, and if you're able to, if it's a respiratory illness, you can cover your face and nose with a well-fitting, mask to help prevent spread of germs.
And would distancing help a little bit too?
Of course, yeah. Social distancing, trying to maintain that 6 feet from others, that definitely would help prevent spread of germs. As most illnesses are spread through droplet, and if you're staying at least 6 feet away, you're usually safe from getting those germs.
So when you're talking about, distancing from folks, what about ventilation? I know that the CDC over the past few years has done some new research on ventilation, and they're saying, if you're going to have a big family gathering, just as a precaution, if it's indoors, at least crack your window or, maybe have your fan on in the house on continuous to help, avoid the spread of germs.
Yeah, definitely. Yeah, definitely. Getting good airflow. If it is indoors, if at all possible, it's even better to have gatherings outside, if the weather permitting.
Mm-hmm.
So definitely, but if you're not able to do them outside, if you do need them to be indoors, trying to maintain social distancing if possible. And yeah, good ventilation, opening windows, running fans, and again, encouraging hand hygiene. Maybe you have hand sanitizer set up around, just to remind people to practice that good hand hygiene.
Yeah. My family members will tell you I've always been a a believer in using hand sanitizer, even well before the pandemic. And if we have a buffet line at a family gathering, I usually have a hand sanitizer right there. And I get teased about it, but again, I want to share joy with my family, not any germs we might be carrying that particular day. So I don't mind taking a little teasing just for trying to keep folks safe. So Valerie, we were talking about hand washing. Chelsea brought up a great point, and that seems like something that should be really easy, an easy thing we could all do to stop germs. Tell me more about hand washing advice and how to do the best job of washing our hands.
Sure. Hand washing is something that's simple to do, but it can be forgotten. Keeping your hands clean is one of the most important things we can do to stop the spread of germs and keeping us healthy. So good hand washing, it prevents 1 in 3 cases of diarrhea.
Wow.
And also 1 in 5 cases of respiratory illnesses like your colds, your flus. So what you want to do is you're going to obviously wet your hands, lather them up, but then you want to scrub. You want to make sure you're getting in between your fingers and underneath your nails, and then you're going to rinse that soap off and dry. But a good way to know that you're doing it long enough is to do it for 20 seconds or hum the happy birthday song from start to finish twice. Or you can sing it if you want, but you can hum it too. But so if you do that, that ends up being 20 seconds. And one thing I've noticed is some people are using, they think if they're using baby wipes to wipe their hands off, that they're getting their hands clean. And that's just not the case. They may be removing surface dirt, but they're not sanitizing their hands. So baby wipes in and of themselves is not cleaning your hands good enough. And we as parents, it's important for us to teach our children, and also by showing our children when it's the right time to wash our hands. So after using the restroom, obviously, before you eat, if you've been handling pets or changing a diaper, or anytime you've been outside, you always want to wash your hands just to make sure that you've washed off any germs that could cause infections, whether it's cold flu, diarrhea, there's other things that you can catch from animals from playing with puppies or kittens that you want to wash your hands for as well.
I'm really glad you brought up the pets, point, because again, folks in our county, we love our pets.
Love our pets.
Sometimes there are petting zoos set up at different events around, and just the importance of washing hands. And you were talking about when you're outside, sometimes in that scenario where you're maybe at a petting zoo, there may not be soap and water readily available. So what other options might work if you can't access soap and water?
Sure. So hand washing is definitely the preferred method. But if there's not a station set up, hand sanitizer, and you want 60% alcohol in that hand sanitizer. So it's always a good idea to keep some with you if you're going to be out and about, just so that if there's not a hand washing station where you can wash your hands.
Okay.
Pre-COVID, I even, carry hand sanitizer on my key ring. It's easy. You can get a little key ring attachment, carry it on your key ring, or, women who, carry bags around purses, you can stick one in there, put one in your car. It's real easy to keep them around.
All right. Yeah, very good. I carry hand sanitizer myself.
Got them stuck everywhere.
Yeah, I understand. And so when we were talking about, different illnesses that we're trying not to spread to others, right? And you had mentioned, colds and flu. Earlier, Chelsea, you had mentioned, COVID-19, take that test, make sure it's negative before you go out if you're feeling sick. But there's another illness that we're seeing more of in the county, actually a couple. One is RSV. We're seeing a lot more RSV. But another is whooping cough, which is also known as pertussis. So tell me a little bit about those illnesses and how we can, prevent spreading those types of illnesses.
Sure. So, if you're sick or your child is ill, keep them home. You don't want to be going to church, to birthday parties, to big gatherings, because sometimes a person, a child, they're ill before you even really realize what's going on. So what you think might be a simple cold could be the whooping cough, could be the COVID, could be the RSV. So if you're sick, stay home. Keep your child home if they're sick. And whooping cough especially, that is a disease that it is vaccine preventable. So there is a vaccine for that. So you really want to get your child vaccinated for whooping cough just to keep them from contracting it. And even as adults, some adults aren't vaccinated, so you can still get vaccinated for whooping cough as an adult.
Mm-hmm. And Valerie, I know that a lot of adults don't realize that it's a good idea to get a booster of the whooping cough, vaccine as an adult. I didn't know that until, so my sisters are about 7 years younger than me. So I learned when they were about to have their first babies, that it was important to get a whooping cough, booster, because even though I had been vaccinated as a kid for whooping cough, that vaccine, it was starting to wane, and I didn't want to risk getting sick and then making my new nieces or nephews sick. So at that point in my life, I did choose to get a booster, and I don't think a lot of adults know that. So Correct. What advice would you have for adults out there that are maybe going to be a new grandma, or maybe they're going to become caregivers for babies?
Sure. So that vaccine that you're talking about is called a Tdap. So there's a couple of diseases that it protects against. So one is tetanus, diphtheria, and then the P is for pertussis. So as adults, it's a good idea if you're pregnant, if you have a family member or a close loved one that's pregnant, that you're going to be handling a newborn baby, get that Tdap shot. A lot of grandparents, babysitters, and then that way you're protecting that baby from getting something from you when you don't even realize that you're sick.
And that really goes with the theme of this show. Babies bring a lot of joy into our lives, and, being protected against illness in keeping that baby healthy is a way to share that joy too. So
I didn't specify fathers, but fathers are included in that as well.
Absolutely. And grandpas as well.
Yes.
Very good. All right. And so, I think we talked a little bit about how vaccines can help prevent infections, but how does a vaccine work that would help specifically in preventing an infection?
Yeah, vaccines help our bodies develop protection from the illnesses that they're trying to prevent, whether that be a viral, bacterial, they help our immune system build up the immunity so that if we become exposed to that illness, it will, our immune system then knows what to do with it. Decrease the severity of symptoms, not that we'll be completely protected from getting sick. I know some people get misinformation that vaccines keep you from getting the illness. That's not true. You are still very susceptible to getting the illness if you're vaccinated. It's just that having that vaccine helps build your immunity up so that you are able to fight it, hopefully not get as sick, maybe no symptoms at all, and then hopefully prevent spread too. If you're not getting sick or getting as sick, you're not going to be able to spread it as well. So, vaccines help in not only keeping yourself safe, but keeping others safe. When we see in studies, they've shown where, areas where more people are vaccinated against a certain illness, we call that herd immunity. If we are reaching an adequate level of herd immunity, that's going to decrease the risk of spread within the community. And we know that there's people that can't get vaccinated, whether that be, through choice or medical reasons. There's just some that can't. And there's some people that get vaccinated but still can't get that full protection from the vaccine because they're immunocompromised. So when we do our part of those of us that can get vaccinated, get the vaccine, we're helping protect those who can't or maybe don't have as strong immune systems. And we're doing our part to help prevent the spread to them who are most at risk for getting, the more severe form of the illness.
Okay. That's very good. And, it sounds like just, again, another way to make sure we're sharing the joy and not germs. We're anti-germ here on the show today and always. So at the Tuscarawas County Health Department, I know we have a lot of programs that make it easier for folks to get their vaccines, if it's back to school vaccines, if it's a COVID-19 vaccine, pneumonia vaccine, flu vaccine. So could one of you tell me a little bit more about our vaccine program and how someone might be able to make an appointment?
I can speak to that. Okay. So we do have an immunization program. We do offer vaccines, babies to adults. And we do take, most insurances, and most insurances will cover any of the recommended vaccines. So you just need to call and make an appointment. You can call the main health department line, 330-343-5555. We do have 2 extensions that will get you directly to one of our scheduling staff. That is 1740 or 1810. And then for people who maybe don't have insurance or are self-pay, we do have programs to get them vaccinated as well. The state allows us to have the VFC, or Vaccines for Children program. So that program helps children who are 18 and under get vaccinations at a low rate. If they're on Medicaid or don't have insurance, or maybe the insurance that they have doesn't cover vaccinations, they can still be vaccinated at very low cost. And then we also have the Adult 317 vaccine program, which helps adults who don't have insurance at all get vaccinations, again, at little to no cost through that program as well, so that we can make sure that, people who are wanting to get vaccinated but maybe don't have the means to do so are still able to get those vaccines.
That's great, Chelsea. So if someone's, sitting at home and watching this podcast or listening to this podcast, they know that their income doesn't need to be a barrier to getting a vaccine to protect themselves and their loved ones. It's great news. But in addition to vaccines, there are some other things we can do that do help to prevent infection. A lot of people say, I can build up my immunity by, eating right and exercising and taking supplements. Valerie, do you want to speak to that a little bit?
Sure. So all of those things are wonderful things to do. Get adequate exercise, eat healthy, avoid the junk food and other things. Those are all great things. That keeps us healthy, that that helps our hearts and our lungs. But in the end, if you're exposed to a germ under the correct circumstances, you're going to get sick. None of us are Superman. So you can't purely rely on your exercise regimen and your eating regimen to keep you from getting sick. You still need to take the vaccinations that are recommended. Stay home if you're sick. And wear a mask if you do need to go out and when you're around someone that may be immunocompromised, or if you're immunocompromised yourself, if you're taking, medications that make it easier for you to get sick, or you have certain health conditions that make it easier to get sick, you can wear a mask to protect yourself and others that you may be around that may be under the same circumstances.
Okay. So the good news is, it's still excellent to eat right most of the time.
Absolutely.
Every once in a while you're going to have an ice cream cone.
Kind of go off the rails a little bit sometimes, but
we're getting into summer season with cookouts.
So, so eat right most of the time, exercise regularly, according to your medical provider's recommendations, take recommended vitamins, that your medical provider has said are okay for you. It's still good to do those things, and those do help improve your immunity.
Absolutely.
But it's also good to take those other steps, like, consider the vaccinations and, of course, still cover your cough and try to stay home if you're sick. Okay, very good. All right, excellent to know. And so how could someone learn more about infection control and ways to stop germs other than listening to this podcast over and over again, which, of course, they're welcome to do?
Absolutely. So, anyone can put anything on the internet. So you need to make sure that your resources are reputable, that they're that they actually know what they're talking about. Someone can put on the internet to, pat your head, rub your stomach, and go in circles 5 times, and you won't get the flu. Well, we know that that's not quite accurate information. So you want to make sure that the sites you get on are good sites, that they're going to have the correct information. So a couple good sites are cdc.gov. They've got a lot of great information. The Ohio Department of Health, which is odh.ohio.gov. They again have a wealth of information on there, and we even look at those sites quite a bit. And then also the Tuscarawas County Health Department page will have some information on there, especially about COVID. We put a lot of COVID information on there, and that's tchdnow.org.
Okay. And so even at the Tuscarawas County Health Department page, I know we have a page about immunizations, and those resources you just mentioned, I think we have links to those too. So if someone's driving by listening to this on the radio, or maybe listening in their headphones while they're on a jog and can't remember, they could go to our website at tchdnow.org and click on the immunization page and find those resources. All right. Very good to know. So ladies, I think we've covered a lot of ground on how to really spread the joy when we're out with our families and loved ones and friends, and not germs. Is there any point we haven't covered that we need to add today?
I mean, I would just say, we don't have to be scared of germs. We do need to take them seriously, and some illnesses can be very serious, especially for those who are immunocompromised, but certainly, we do want to spread joy. We want to be happy and healthy. And we want the community to be happy and healthy as well. And the Tuscarawas County Health Department, Val, myself, Jen, I know we're always happy to answer questions, take phone calls if people have questions, and just want to talk about infection control and, what they can do to protect themselves and others.
That's a perfect point, and I think it may be a good way to end the show if you agree, Valerie.
Absolutely.
All right. Well, thank you, Valerie. Thank you, Chelsea, communicable disease RNs at the Tuscarawas County Health Department for your time today. We're spreading the joy and not the germs, and that's how we want to keep it. So for the Tuscarawas County Health Department, I'm Jennifer Demuth. Thank you for joining us today. We hope you and your family and friends are out there spreading joy and not germs.